Good afternoon. We're here for today's public hearing for the agencies administering the United States Housing and Urban Development Formula Grant Programs. We are required to report to the public the progress that we're making on our goals and objectives that we identified in the state's 5-year consolidated plan. And that period is from 2020 to 2024, as well as in our consolidated annual action plan, which is the 2023 action plan. We'll also give you the opportunity to provide us we're providing you with the opportunity to comment on our performance of these grant programs during our 2023 program year. And that began April 1st of 2023 and ended on March 31st of 2024. We also are allowing the public an opportunity to give comments about the needs of their communities for our upcoming 2025 program year as we prepare to complete that. So we have completed a draft report summarizing and evaluating our performance of these programs, referred to as the Consolidated Annual Performance and Evaluation Report, or the CAPER. The CAPER is available for our review. We have some printed copies here today, and it's available on the state agencies' websites. The state agencies that participate in the consolidated planning process and that administer these programs and report annually on the accomplishments are the Division of Administration, Office of Community Development, Local Government Assistance, that administers the State Community Development Block Grant Program, the Louisiana Housing Corporation, which administers the Home Program, the Housing Trust Fund Program, and the Emergency Shelter Grant Program, as well as the Louisiana Department of Health, Office of Public Health, STD, HIV, Hepatitis Program, which administers the Housing Opportunity for Persons with AIDS Program, or HOPWA. We'll each present you with a summary of accomplishments on our respective program, and we'll take comments for each at that time. Written comments may be provided on a form available on the table in the back, or can be submitted to our offices. That is available on our website at the Office of Community Development, Local Government Assistance. We have a place for you to make comments and the information of who to send that to. We'll be accepting comments through June 18th, and those comments will be included in the CAPER. We'll go through each of the programs. First one up is the Office of Community Development, Local Government Assistance's program, the Community Development Block Grant Program. This office provides financial assistance, or this program provides financial assistance to non-entitlement local governments throughout the state. Eligible activities under our FY 2023 program include community infrastructure systems such as water, sewer, street improvements, as well as demolition and economic development assistance. Projects funded under this program must principally benefit persons of low to moderate income, prevent or eliminate slum and blight, or meet urgent community development needs. In the 2023 program year, this office awarded $21,257,232 in CDBG funds to 28 units of general local government for public infrastructure improvements that will benefit at least 70% of persons of low to moderate income. Additionally, 18 local governments have been awarded a total of $4,587,488 in funds under the clearance program to eliminate and prevent slum and blight. These totals include returned funds as well when projects close out and have funds remaining. There were no funds awarded under the Economic Development Program, and those funds were reallocated to the Public Facilities Program. Public facilities projects included existing infrastructure, which benefited 154,682 persons. They made new connections for 90 households, of which 100% are of low to moderate income, and also benefited 45,088 people under new infrastructure projects. Those are the projects that closed out during the program year. Additionally, our office is administering funds under the CARES Act. At this time, all of those funds have been awarded. $2,097,478 have been awarded and dispersed through the food banks in the state, throughout the state. $2,320,089 have been dispersed for economic development. $473,453 are for the benefit of senior centers, public facilities through senior centers. Neighborhood facilities have been improved and have dispersed $2,479,935 in funds. We have operated a parks program, which has dispersed $5,302,648, and other public improvements made were dispersed in the amount of $655,500 and $3,000. Additionally, $3 million was spent on acquisition of property for these funds. Next up, we have Alvin Johnson Jr. with the Home Program and the Housing Trust Fund Program to report.
Well, thank you, Heather. The Home Program and the National Housing Trust Fund Program are two programs that are administered by the Louisiana Housing Corporation. The Home Investment Partner Program is authorized under the Cranton-Gonzalez National Housing Affordable Act of 1990. It is one of the largest, if not the largest, federal grant program that is exclusively designed for the production and the preservation of affordable housing for low-income households. Low-income households are households that are at or below 80% of the area median income. Home regulations also can be seen at 24 CFR Part 92. There are eligible activities under the Home Program. They are in this order: home buyers activity, rental housing activity, homeowners rehabilitation, tenant-based rental assistance. With respect to home buyers and rental activities, it can be acquisition or rehab or new construction. There are some special provisions that applies to the Home Program. One of those special provisions is the fact that we have to match at least 25 cents for every dollar of home funds that are spent. In addition to that, a PJ, which is oftentimes referred to as participating jurisdictions, have to reserve at least 15% of their annual allocation of funds to be awarded to the nonprofit groups designated as community housing and development organizations. The PJs must ensure that home-funded housing units remain affordable for the longer period of time. New construction is 20 years, and then rental housing can be anywhere between 5 and 15 years, depending upon whether or not you're dealing with new construction or rehab. Also, when you're talking about home ownership activities, you still have another 5 or 15-year affordability period that has to be met, and it all depends upon the type of housing, whether it's new construction or whether or not it's acquisition rehab. And then finally, it depends upon the amount of resources that is put into those particular projects. Once again, if it's rental housing, new construction, 20 years. If it's home ownership, new construction, 15 years. Another program that is administered by the agency is the National Housing Trust Fund. This is a fairly new federal program for the production and preservation of houses that complements existing programs such as your home program, tax credits, and a few other type programs that may be there that may be layered with National Housing Trust Funds. National Housing Trust Fund has a specific purpose of preserving and increasing the supply of decent, safe, and sanitary housing, particularly targeting extremely low and very low income households. That also includes your homeless families and individuals. National Housing Trust Fund was established under Title I of the Housing and Economic Development Act of 2008. Regulations are similar to home, but there are several key differences. Most importantly, National Housing Trust Fund has deeper income targeting, lower rent requirements, and a longer period of affordability. At least 75% of the funds must always be used exclusively for extremely low income families or families with income at or below the poverty line, whichever is greater. The rents for your National Housing Trust Fund units or designated units are capped at 30% of 30%. That sounds like it's strange, but what it simply means is that 30% of your extremely low income, that when you're looking at what type of rent can I charge for one of these type units, if you're interested in using these funds for the purpose of development, then you'll realize that you should anticipate having to layer these funds with other resources if you're going to have an affordable project. Any National Housing Trust Fund that are not used for extremely low income households must be used for what is dubbed as your very low income household. Very low income households are households at or below 50% of the area median income. As far as the period of affordability, all National House Trust Fund assisted units are required to have a minimum affordability period of 30 years. As far as eligible activities include rental housing, home buyers activity, and what we call reasonable administrative and planning costs. If you need more information concerning either one of these programs, you can contact the agency by you can go to the agency's website rather. Now, generally this will be seen where you can see it, but the Louisiana Housing Corporation address is 2415 Quail Drive, or you can go to the agency's website at www.lhc.la.gov. Let me give you a few accomplishments and highlights from the program. During the year of 2023, which is our program year, the Louisiana Housing Corporation received $11,624,404 in home funds as an allocation. During this same reporting period, we also received program income of $3,016,982. According to the home rules by HUD, we must layer those two funds together when we're saying how much funds are available for any given program year, both the allocation as well as program income from the previous year. Now, the amount of home funds that was available at the beginning of 2023, including program income, was read at $14,641,386. According to our drawdown report, we expended $16,227,880. That also included program income and funds that was committed from prior years. As far as productivity, so what did you accomplish? During the 2023 program year, as far as rental housing activity, 38 units was completed with respect to the home funds, We had 23 units of home ownership housing that was added during that same period of time. As far as direct assistance to home buyers, we had 20 households that received direct assistance through the home funds. And as far as tenant-based rental assistance, 9 households received assistance. Well, it seems as though you would think that production is down, but not necessarily. When you look overall, you're finding that many of those that was receiving tenant-based rental assistance were now being assisted by other resources, or they found a more permanent source of housing. And therefore, the greatest use of tenant-based home funds for tenant-based rental assistance was during the pandemic. And at the height of the pandemic, there were 683 households that were assisted with home funds during that period. As far as geographic distribution, home funds were distributed through 7 initiatives that was utilized. Most of these initiatives was utilized by nonprofit developers, and would simply mean that they develop fewer houses, because it's more expensive, and then you're also developing, like we said earlier, fewer houses. Now, that's not going to be the case for 2024. In 2024, we look ahead to seeing that there are several projects in the pipeline that would yield considerably more completions than what we've seen in 2023. As far as the National Housing Trust Fund concerned, the state received $4,515,321 in National Trust Fund during the 2023 reporting period. And of this amount, we expended $4,750,505. What that included was also funds that was committed from a prior period. As far as leveraging, in addition to home funds, the state also used non-federal resources, including state bond sale proceeds, housing tax credits, private lenders, grants, to finance affordable housing activities for the extremely low and very low income households. These included homeless families and individuals. National Housing Trust Funds during the year of 2023 was also awarded in conjunction with housing tax credits, because that is the biggest or largest source of leveraging of funds that is available in the state. The state committed $7,332,682 of National Housing Trust Fund to 6 projects in 4 parishes: Caddo, East Baton Rouge Parish, St. Landry, and St. Tammany. The trust fund investment commitments of $7,332,682 leveraged an additional $74,926,545 in other resources to develop a total of 347 proposed units, and 40 of these are designated as housing trust fund units. 2 of these projects were completed during the 23 program year. 28 of the 36 total units that was designated as the housing trust fund units, and also the housing trust fund completed units again was located in Evangeline as well as Wynn Parish. These are just a few highlights of our efforts, utilizing both home funds as well as housing trust funds there. And the state anticipates receiving at least $11 million in home funds during the next, for the fiscal year rather, of 2025, and no less than $3 million of housing trust funds for the same program year 2025. Our purpose here today is to solicit your comments on the distribution of these anticipated resources, as well as your comments concerning the accomplishments of past resources. Now we'll turn it into the hands of, not Amy, but
Good afternoon. This is Winona Connor with
Winona
Louisiana
Connor.
Housing Corporation. I'm going to talk about the Emergency Solutions Grant Program. This program is a federally funded program which the state distributes across the state to local units of government, continuums of care, and nonprofit agencies. These funds are used for the assistance with homeless services activities across the state, which include development of homeless shelters, operational costs for homeless shelters, data input to record our inputs and outputs, street outreach activities, rapid rehousing and prevention activities. Those are the activities that help individuals move from homelessness into housing. This funding is authorized by the McKinney-Vento Homeless Assistance Act and authorized in 2009 by the Homeless Emergency Assistance and Rapid Transition to Housing, the HERTH Act. In fiscal year 2023, ESG funds were a little over $2.6 million. These funds, as I said, are allocated across the state of Louisiana to help projects enhance or expand the activities that they're doing. For fiscal year 23, we funded 16 projects. We had 16 recipients. Of those, 5 of them were continuums of care. We had 6 units of local government. We had 3 nonprofit agencies, 2 outreach agencies, and 19 shelters that received funding. Now, this funding could have went to a continuum of care and then as a subrecipient went down to a nonprofit agency. So one recipient from the state may have multiple subs under them. That's why you see the numbers kind of span out. As I mentioned, the activities are used to enhance the services that are made available within the continuums of care or within the regions of the state to service homeless individuals and families to ensure that they have access to services and resources that are needed to gain and maintain their self-sufficiency in the community. We partner with many other state agencies and nonprofit agencies to leverage the funding that we have to ensure that we're able to meet the needs of the communities. The goal of the ESG funds are to increase shelter capacity, so make available shelter beds, and then also to make available rental resources to those households that are in need. All participants that are served in the programs have to be at or below 30% of the AMI. So we're targeting the low to very low income households. Many times those households have 0 income. The additional goal is to reduce and end homelessness. So all the work that we do within this program and within our department is aimed at reducing and ending homelessness. I would mention that in 2023, our department expended all of our CARES Act funding. $39.2 million was expended, and those funds were all expended to address homelessness across the state, make available shelters, provide rental resources, and give shelters the funding that they need to operate and serve the individuals. Homelessness should be brief and rare, non-reoccurring, and so these ESG funds are administered across the state to ensure that the individuals that need the assistance are able to access it. All assistance is administered through a coordinated entry access point, so all individuals access services in each community in the same way. So it is an equal opportunity resource. Anyone who shows up should be able to get the resource. So with that, I will turn it over to Hopwa.
Hi, my name is Susan Garner, and I'm the housing specialist for both the Ryan White Part B and the HOPWA programs. But today I'll be talking about the State Formula HOPWA program. The State Formula HOPWA program is administered by the Louisiana Department of Health, Office of Public Health, STD HIV Hepatitis Program, or LDH OPH SHIP, as mandated by the federal requirements set forth in 24 Code of Federal Regulations 574 and the state requirement in Louisiana Revised Statute 40, 2018.2. The overall goal of the state formula HOPA program is to increase the availability and accessibility of appropriate and affordable housing options for low-income persons living with HIV and their families in order to prevent homelessness. This goal is achieved through a mix of community-based initiatives in the service area, which consists of the largely rural 53 parishes of public health regions 3 through 9 and excludes the metropolitan areas of New Orleans and Baton Rouge. There's a project sponsor located in each region of the public health regions to ensure service access and delivery. The total HOPA award for fiscal year 2023 was $3,526,968. However, all funds expended during the 2023 program year, which spanned April 1st, 2023 to March 31st, 2024, were prior year funds. In total, approximately $2,835,795 were expended and 769 households served. This includes 3% of funds retained by the state for administration. The remainder of the funds were allocated to project sponsors for the performance of HOPA activities as follows. Tenant-based rental assistance, or TBRA, provides a subsidy to HOPA-eligible households in a qualifying unit of their choice in the private rental market. On October 27, 2022, the program initiated use of a HUD-approved HOPA community-wide exception rent standard of 140% fair market rent, or FMR, rather than the FMR rent standard that was previously used. The goal for fiscal year 2023 was 210 households and 240 were served. Short-term rent, mortgage, and utility assistance, or STRIMU, is a short-term stabilizing intervention for currently housed HOPA-eligible households that are not receiving ongoing rental assistance and are experiencing a financial crisis. The goal for fiscal year 2023 was 400 households and 443 were served. Facility-based housing assistance and development, or FBHSA, is the leasing, operating, and maintenance costs for housing facilities. There are 2 congregate facilities and 1 single-family facility. All of the facilities are permanent housing. The goal was 18 households served and 24 were actually served. And then we also utilize permanent housing placement services, or PHP, which provides assistance for eligible costs such as deposits and application fees to establish permanent residency where continued occupancy is expected in order to place eligible clients in appropriate and affordable rental housing. The goal was 205 households and 193 were served. Resource identification was also funded. RI is a system-level activities to increase access to housing, including building capacity for additional access to rental housing. 3 regions received this funding during the fiscal year 2023. In fiscal year 2024, the program plans to continue funding these services and plans to add HOPA support services, housing-based case management, focused on housing assessment, placement, and housing stability to ensure the success of HOPA clients. SHIP's HOPA program planning is informed by program utilization data and a biannual needs assessment of people living with HIV. In the most recent 2021 needs assessment report, half of respondents in the service area reported difficulty in paying for rent, mortgage, or utilities in the prior year. Current program planning is mindful of research that shows housing is healthcare, and there is an association between housing stability and viral suppression. Viral suppression occurs when a specified low level of virus considered undetectable is achieved and HIV cannot be transmitted to sexual partners. This is colloquially known as undetectable equals untransmittable, or U equals U. Unstable housing and homelessness decrease the ability of persons living with HIV to achieve or maintain viral suppression and lead to suboptimal health outcomes for not only the client, but also increased opportunities for HIV transmission to potential partners. Finally, the service system embraces HUD's Office of HIV/AIDS Housings, or OHH's new approach of reset, renew, recharge, known as the 3R initiative. It's intended to enhance HOPA program design and promote core values that will positively impact the lives and housing stability of people living with HIV. This includes promotion of client-centered, low-barrier approaches to service delivery informed by housing first and harm reduction principles. We're seeking public comment on the housing needs of people living with HIV in the regions of Louisiana outside the metropolitan areas of New Orleans and Baton Rouge. This input will be utilized in the development of future plans. Thank you.
This concludes our public hearing. Again, we'll be taking public comment. It's actually through June 19th that you could submit comments. That information is found on the Division of Administration Office of Community Development's website. The contact information for and instructions for submitting it. Thank you for your time.